In inguinal hernia, if it is not treated, it may increase in size. Sometimes it may go into the scrotum of the male patients, and it may cause again ulceration of the skin. There may be what is called a strangulation, wherein the blood supply is cut off to that particular region and the intestine starts to swell. Because of this swelling, the walls of the intestine die out and they perforate. Therefore, the infection and the pus that is there will collect in that particular region, may come out through the skin, may go back into the abdomen, again causing severe distress to the patient, even in some cases infection and death of the patient.